of industry trainees under this government.
Leave us sought to table that document. Is any objection? There is objection. Question number 2, Ururoa Flavell. Order. I want to hear Ururoa Flavell.
Tēnā koe, Mr. Speaker. Kia ora tātou katoa. Ko taku pātai he pātai ki te minita mō ngā take haora. My question is to the Minister of Health. Does the government believe that it is acceptable that 2 out of 3 Māori and Pacific Island diabetics die from diabetic complications compared to 1 in 3 Pakeha diabetics? And what actions has he taken to reduce the inequities in light of the fresh predictions that by 2020, 1 in 6 Māori and Pasifika adults will have diabetes?
The Honourable Joe Goodhue.
No, Mr. Speaker, no. The government does not believe that it is acceptable, which is why improving diabetes care in primary care is a government priority and is included as one of the government's 6 health targets since 2008.
Supplementary.
Ururoa Flavell.
To the Minister, what specific long-term measures are being devised to reduce rates of Māori, Pacific people and those living in deprived neighbourhoods in light of the projections that the incidence and mortality rates for type 2 diabetes are expected to increase over the next 20 years, with the biggest impact being on these groups?
The Honourable Joe Goodhue.
Mr. Speaker, the Māori population is at greater risk of developing gestational diabetes. The Ministry's current project with a focus on gestational diabetes and health literacy, particularly in regard to Māori, may help Māori women and others to be better informed about screening for and management of gestational diabetes. This is or will be a long-term project and has had $121,000 spent on it. The final report on this is due in December the 7th and will be published by the end of January. With regard to Pacific peoples, the Pacific Innovations Fund, there is $6 million announced as part of the budget this year to establish that fund and to administer it over 4 years. That will invest in long-term health initiatives to demonstrate innovation through application of new strategies, models and methods of service delivery to, in particular, look at things that are affecting Pacific people's health like obesity and smoking.
Ururoa Flavell.
Thank you, Mr. Speaker. Does the Minister agree with Te Rōpū Rangahau Hauora Eru Pōmare that screening for signs of prediabetes and insulin resistance related to obesity and management of these conditions is important? And what new programs will be invested in to replace successful diabetes prevention programs such as Get Checked, Healthy Action, Healthy Eating and Nutrition Guidelines for School Tuck Shops, all of which are programs that have been scrapped by the government?
The Honourable Joe Goodhue.
Mr. Speaker, yes, screening is important. We've been working with the Prime Minister's Chief Science Advisor, Professor Sir Peter Gluckman, who suggests that preconditions for obesity are set really early and the best intervention point is maternal and newborn nutrition. I do want to acknowledge that the member has maintained that Get Checked was a successful program and to disagree with the member. A 2011 review of recent studies on the Get Checked program showed that the Get Checked program did not systematically result in improved management or outcomes for people with diabetes. So we ring-fenced the budget, approximately $8 million, and asked DHBs in primary care to work together to design localised responses to best support people with diabetes. This government is trying to work with programs that are effective, that do work, that are a good return on the investment of the taxpayer funding.
Question number 3, David Bennett.
Mr. Speaker, my question is to the Minister of Finance. What reports has he received on progress in lifting